We've talked about the importance of diagnosis. I mean, that goes without saying. I think every healthcare professional knows diagnosis is key, right? You go to the car mechanic's shop, and if he doesn't diagnose your car problem correctly, right, bad things happen. So same thing with the human body. I mean, that's pretty basic. But we've talked about the fact that we need to diagnose quickly. We've talked about some criteria that have been used for diagnosis. We've talked about the fact that we need to go even above and beyond some of those criteria when we really want to delve into some complicated CRPS cases. Let's talk about who gets CRPS. You know, what's the backstory behind the disease? Again, CRPS is part of this cluster of pain called central sensitization. Just to go over the 4 clusters of pain, okay, so we are all on the same page. Cluster number 1, we've all heard of neuropathic pain or nerve pain. Cluster number 2, we've heard of nociceptive pain, things like, you know, when your bone is hurting or organ pain. Cluster number 3, inflammatory pain, okay, so things like arthritis or other types of inflammation. Then cluster number 4 is central sensitization. Probably the least understood or the least aware of all the clusters. And central sensitization is the central nervous system. The central nervous system is not firing correctly. It's either misperceiving or misinterpreting signals. Now, why is it doing that? Well, it's doing that because it's become sensitized. It's become sensitized to some type of injury or some type of event or some type of memory. But something has caused the brain to think that a problem is persisting, to think that an injury is persisting, to think that maybe, you know, the leg or the tummy or the arm or whatever part of the body is affected is undergoing an ongoing traumatic event, and it's trying to protect it from that event. And that's a fundamental disease process, obviously in very, very easy terms. So the brain is literally thinking that, you know, that there's a problem. So that's where you're going to see changes in the motor system. You're going to see changes in the vascular system. You're going to see changes in the way that it's trying to protect, let's just say, the extremity through sweating or through, you know, hair changes, through vascular changes. And for some reason, and we're not quite sure why, there are some hypotheses out there, but for some reason it affects women far more than men. There have been hypotheses as to why. They've been, you know, maybe it's genetic, maybe it's the way the neural system is set up for some reason in women more than men. Maybe it's related to hormones, maybe it's related to the way different genders handle stresses. We're not really sure, but even if it's related to all those things, you know, why? The question becomes why. And we're not really sure. But there's absolutely no doubt that it affects women far more than men. I can say, at least in our practice, we're seeing probably close to almost a 10-to-1 ratio, women versus men. Some of the published data out there varies, but every single piece of data out there shows a dramatically higher rate of women versus men. But you know what? We're seeing that with other diseases as well. So fibromyalgia is a form of central sensitization. And fibromyalgia very much could be looked at similar to CRPS. A lot of people will say, hey, they kind of look similar to each other. And you know what? They are very similar to each other. Fibromyalgia is really this chronic, widespread neuropathic pain hallmarked with central hypersensitization and central hypersensitivity. So your whole body, you know, feels hypersensitive, but you don't really have some of the hallmarks that you see with CRPS. And that affects women a lot more than men. The published data on that is very close to that 9-to-1 ratio, women versus men. But you know, another disease that is a central pain condition is something called PTSD, post-traumatic stress disorder. I had many publications looking at the mechanism of post-traumatic stress disorder and some procedures that have helped with post-traumatic stress disorder. So it's a condition that I've worked on for many, many years and seen patients from all over the place with PTSD. And PTSD and CRPS are very similar centrally. Peripherally, they manifest a little differently. But with PTSD, we see women, we see men with PTSD. A lot of people think PTSD is a man's condition, but mainly because a lot of PTSD exists with the military. We associate PTSD with the military. But you know what? I see a lot of PTSD in women. We've seen a lot of patients who have been abused, harassed, molested, beaten, or a variety of other things that have affected them throughout their life. And it's created this hypersensitization in their brain. And we've seen patients who have PTSD end up developing CRPS because their brain has become already sensitized. And then the patients experience some type of injury. And that injury could be as innocuous as an IV start. I've actually seen CRPS because of an IV start. We've seen CRPS because of surgery. We've seen CRPS because of some type of fracture. We've seen CRPS because of some type of minor injury, like an ankle sprain, right, or even stubbing a toe. I've seen CRPS from eye surgery, LASIK surgery, right? Something that most people have never heard of, but if you actually start looking it up, there are many case reports, and in fact even groups, right, little Facebook groups or closed groups where patients are saying, hey, I developed CRPS after LASIK surgery. So it can happen without any previous sensitization, but when patients have become sensitized already, the chance of it developing becomes substantially higher. So what's the take-home point there? Take-home point, obviously, is understand the mechanism, understand the disease, understand that it affects women more than men, but also the big take-home point is when patients have had central sensitization, they've already been sensitized because of some type of event or whatever, really pay close attention to those patients, pay especially close attention if they're undergoing a surgery, because they are absolutely more predisposed to potentially developing CRPS after that surgery. And those patients are going to have to be pre-medicated in multiple different ways to try to lower the sensitization that the brain will feel and lower the chance of progression to CRPS.